Okay, everybody. Hello, I'm Roger Waldinger. I'm professor of sociology at UCLA, director of the Center for the Study of International Migration, and I'm delighted to welcome you to today's session, which is co-sponsored with our friends and colleagues at the Center for Comparative Immigration Studies at UC San Diego. This is the last of our online offerings. We anticipate resuming in the fall, but at the UCLA campus, our program is ongoing. So let me just, for those of you who are at the UCLA campus or in the LA area and might be on campus for future events, let me just tell you that there will be a June 3rd talk by Félicien de Hirsch, who is a Fulbright postdoctoral research fellow, talking on migration, street vending, and social protection. So a talk related to today's topic, and then a June 7th, a Friday, June 7th talk in our usual place and our usual location, that is Bunch Hall 10386 at 12 o'clock by Adriana Mangual Figueroa, talking on knowing silence, how children talk about immigration status in school. But today, I am delighted to present Peggy Levitt and Erica Dobbs, who are co-authors of a very interesting new book, Transnational Social Protection, Social Welfare Across National Borders, just published by Oxford University Press. And so Peggy and Erica will present their book, talking for somewhere between 20 to 40 minutes. Then they'll be followed by a comment from Jean-Michel Lafleur, who is good enough to be joining us at 9 p.m. his time from the University of Liège in Belgium. And Jean-Michel will talk for roughly 10 to 15 minutes. We'll go back to the presenters for some brief reactions, and we'll open up for comments. So once we go to the comment part of the session, if you would please raise your hand, and then I'll recognize you, and we will, depending, of course, on interest and engagement, we can continue until 1:30 Pacific time. So now, let me turn the baton over to Peggy and Erica.
Thank you, Roger. Hi, everybody. It's a pleasure and an honor to be here, and I want to thank Roger and Claire and Warren and all the other people involved in these two workshops for giving us the opportunity to present our book to you today. We'll be presenting on behalf of our two other co-authors. So that's Ruxandra Paul from Amherst College and Ken Sun, who's from Villanova University. And Erica and I are going to tag team throughout the presentation. So it's really great to see old friends here. Thank you for coming, and hopefully to meet some new friends during our discussion. Before I start, I want to say a little bit about how we started writing this book and what we had in mind for its scope, what it is and what it's not. We are two sociologists and two political scientists, and we each worked on every chapter. So in other words, one person was not in charge of the chapter on health and the other person in charge on the chapter on education. But we all worked, we did a round robin and a round robin and a round robin until we finally got to a version of each chapter that we were comfortable with. And then I edited for language and tone, so the book sounded like it was written by one person. And we decided to join forces to write this book together because we each encountered examples of what we came to think of as transnational social protection in our own individual fieldwork. So for me, the first example was when I was in Germany, and I learned that German nationals have to have long-term care insurance as senior citizens, but that many people could not afford that in Germany. And so they ended up going to care homes in Poland. but then the price of care for Polish nationals became too high. And so there was a kind of domino effect, and Polish nationals had to end up going to neighboring countries as well. And then the second example is of binational health insurance schemes. And I was trying to remember, Jean-Michel, because I think that you also early on told me about something with Mali and France, right, that you wrote about. And Erica and I have found in both public and private health insurance schemes between California and Mexico, whereby people get their primary care in Mexico and their emergency care in California, and that some of these schemes at least opened up to non-migrants. So they became lucrative enough that they opened up to non-migrants as well. So we wanted to document these developments, not just in the United States and Europe, but around the world. So what our book is a kind of synthesis or a summary of different examples of transnational social protection at a particular point in time. So it's a snapshot that, you all know that policies change, especially when political parties change in power. And so we captured a particular vision of transnational social protection at a particular moment. And what emerged for us was a framework and a set of concepts and understandings that helped us start to understand these dynamics around the world. So it's not a political economic analysis of why the particular arrangements that we found emerged at a particular time. We think of it sort of as an offering or as a starting point, so that there's a lot of work to be done afterwards, including to see whether these concepts work in other parts of the world, or how they need to be, how our framework and our ideas about resource environment need to be changed to fit with other parts of the world. So we hope that this book jumpstarts a conversation and more research and more comparisons across time and space, and that some of you might be inspired to join us after our presentation today. So I'm going to turn it over to Erica.
Okay, I'm gonna share screen with everybody, and hopefully this works because, Zoom.
Doesn't always.
I know you think I would have figured this out by now, and yet, so let's see. Is that good?
There you go. Yep.
Okay. Great. Okay. So I'd like to start the discussion with a question that I often use to kick off my comparative social policy class. And that's a class that takes place in the building that you can see here at Carnegie Hall. So I teach at Pomona College in Southern California. And the street in front of the building is kind of an endless competition between cars, bikes, pedestrians on their phones, and students on skateboards and scooters. And so the question I always ask is, what would happen if you left class, tried to cross the street in front of Carnegie, and you got hit by a car? So if you're me and you're a professor at kind of a wealthy private institution, and you have fairly decent private insurance, you call an ambulance, you go to the hospital, I hand over my insurance card, I get treated and go home. When I ask my students this question, many of them respond with, no, don't call an ambulance. It's the first thing they say, because they don't want to pay for it. And so the prudent thing is to call a friend to take you to the emergency room. And so then we can start going through kind of multiple iterations of this scenario. What would happen, for example, if instead of a professor with private insurance, you were a cleaning contractor, right? So if you work for, say, a company like Unico, but you had a union contract, then you might well do the same thing, call an ambulance or go to the hospital, use your insurance and go home. And maybe even more importantly, you could use your paid sick days to recover. And if necessary, you could tap your short-term disability policy if you couldn't do your job, which, unlike the job of a politics professor, right, is very physical if you're a landscaper or a janitor. But what would happen, say, if you weren't unionized? So maybe if you're a citizen among the working poor, you could qualify for Medicaid or short-term disability, but you would likely need some kind of help from family or from your church to put food on the table and keep the lights on. Then what happens if you're not a citizen? What happens if you're undocumented? Now, not only do you have no access to social protection from government programs outside of the emergency room, your ability to help your family members with their own school or medical bills through remittances may be sharply curtailed. So if we were having this conversation in, say, Southern England and not Southern California, we probably wouldn't even have it because it would seem insane, right? In the UK and most other wealthy liberal democracies, citizens have their healthcare covered through some kind of government or government-backed program. But this kind of state-driven model is increasingly out of fashion, even in parts of Europe. So again, we can run through these different iterations endlessly, but all of these point to a few things that are really important motivating factors for this book. The first thing is that bad things can happen to anyone, but where they happen and under what circumstances affect the kinds of social protections that people have access to. So experiences with childcare, education, work, healthcare, and elder care are mediated by where you live, what passport you carry, and the resources available to you, not only through the state, but through alternative sources of social protection, such as friend or kinship networks, NGOs, or even the private sector. That said, how we think about social protection, and the we here being social scientists and policymakers, is often very focused on quote unquote the state, right, as a provider, and where the territory of the state is being the extent to which states are responsible for their citizens and only their citizens. But everyone here knows we live in a world on the move, right? We live in a world where over 200 million people reside outside of their country of birth. And in many countries, upwards of 5, 10, or even 20% of the population is foreign-born. So the big overarching question then that drives this project is, in a world on the move, how do individuals and their family get access to social protection? And by social protection, we mean things like healthcare, unemployment or disability insurance, and old age pensions. We can also think of childcare and elder care as forms of social protection. And so there's two really important underlying questions here as well. How do individuals and their families provide for themselves outside the traditional framework of the nation state? And this is something that political scientists in particular, right, maybe need to think a lot about. And also, how is the contract between state and citizen changing? Who are the new winners and losers when rights, residence, and citizenship are decoupled? And these are particularly urgent questions in the current moment because the context in which millions of people live, work, study, retire has shifted pretty significantly in the last several decades. So our argument in brief is that state-driven, territorially limited, and nationally bounded systems of social protection are giving way to, or at least operating in tandem with, transnational modes of social protection. That said, greater protection for some can mean greater precarity for others, and this is a takeaway that we're going to come back to again and again. So just to quickly sketch out this new context that we're operating in when we think about social protection, we draw from kind of a disparate existing literature across both political science and sociology. And we map out 3 key shifts in the book: territorial shifts, the source of protection, and the progression of citizenship. If we think about territorial shifts, we have changes in kind of the sites, the scopes, and the scale. Let me unpack that really quickly. So we think about sites, we're used to thinking about the site of the nation state as being the place where social protection is possible and where states bear responsibility for their citizens. So in the past, to leave the territory of your home state and cross into another territory as a non-citizen meant that you effectively absolved either state of responsibility for you. This is not the case today necessarily. Citizens are exiting with voice and demanding more from their countries of citizenship. And increasingly, there's movement for states to take on more responsibility for non-citizen residents, although this is very controversial in a lot of places. In terms of scope, the scope of the state when it comes to social policy is also shifting. We see downsizing of the state in the face of refamiliarization, marketization, and neoliberalism. But we see supersizing in that the state's being pushed to think beyond citizenship and borders when it comes to its responsibilities for social protection. So, for example, diaspora policies are part and parcel of modern statecraft. And finally, we have a question of scale. So we're used to thinking of national governments as being the scale at which we conduct our analyses. But increasingly, we can see possibilities for social protection at the subnational and international or even supranational levels. So we need to be ready to adjust our lenses a bit when we're looking at when and how people have access to social protection. The second core context is the source of protection in terms of thinking about the state giving way to the market, NGOs, and family kinship networks. Now, this shift isn't necessarily new, but what we're also seeing is that changes in that that these four things don't just operate locally or nationally, but transnationally. And the last component is citizenship. So we always run back to kind of the classic T.H. Marshall, right, view of citizenship and kind of a linear right, access to rights, right? You get legal rights and political rights and social rights. And we see that kind of unwinding. In the US, we all know that just because you're a US citizen doesn't mean you have social rights. And increasingly, it doesn't even mean that you have political rights. In other countries, non-citizens may actually have political rights and use them to protect their social rights. So social rights may not be contingent on citizenship, but rather residency. And overall, we can see kind of disaggregation of citizenship and social rights. And again, this is not without controversy. So at this point, I'm going to hand it back to Peggy to walk through kind of some of these definitions.
Okay, thank you, Erica. So just to sum up where we are so far, what we're arguing is that state-driven, territorially limited, and nationally bounded systems of social protection are being replaced by, or at a minimum, operating at the same time with transnational modes of social protection. So rather than treating the national and the supranational as strongly connected, but still disparate and discrete, we see individual migrants and non-migrants and the national, regional, and supranational institutions and policies that affect them as embedded in the same transnational social fields. They protect themselves and their families using resources derived from the multiple sources and sites within these fields. And while the state is still a crucial actor, it by no means acts alone in providing social protection. Beyond countries of origin and destination, we include, as Erica said, the market, NGOs, and communities as potential sources of support. Individuals use these in countries of origin and destination to create resource environments that heighten vulnerability for some and liberate and empower others. Resource environments are generally also more informal and place more of the onus on the private individual to protect and provide for themselves. So our argument tries to move the conversation about social protection forward in several ways. First, we analyze national and supranational laws together with people's everyday lives. So trying to put laws and policies and flesh and blood people and talk about them in the same breath. Second, we use a multi-scale or multi-sided approach that brings to light how subnational, national, and transnational actors either complement, supplement, or subvert one another. And that goes beyond what a lot of the literature has done in the past, which is to look at binational or trinational arrangements. And so by doing this, we unsettle a kind of what has been thought of as a static relationship between citizenship, protection, and space. Third, we expand upon the notion of resource environment, which takes us beyond state actors as the primary providers of social protection. And we trace how the different logics of constitutional rights, human rights, commodities, and communities affect the social protection available to non-resident citizens and long-term residents without citizenship. Finally, our analysis incorporates understudied social protection sectors. So a lot of work on social protection looks at the categories of the OECD, and we use those, but also added education and labor rights, which have not been considered in much of the conversation. And our book is in fact organized along the cycles, the stages of the life cycle. So we start with children and protections for children and families, then we talk about education, healthcare, labor rights, and then senior care. And we discuss these developments beyond Europe and the United States, which a lot of the research has focused on, or at least focuses on migrants from the global South to global North contexts. Let me say a little bit about, I'm on the next slide now, Erica. Let me say a little bit about how the different logics underlying various approaches to transnational social protection redefine understandings of who and how individuals access social protection. And then I'm going to offer a few empirical examples to try to make this more concrete. The developments we describe drive forward a reconceptualization of economic and social protection, not only as being a function of constitutional rights, which is what we're mostly accustomed to thinking about, but also as human rights, commodities, or rights endowed on the basis of membership in a community. These understandings operate simultaneously, but combine and dominate debates differently across different social and political contexts. Constitutional rights, together with the welfare state, build on national constitutions and other legislation that mandate the rights and opportunities available to all citizens, and in some cases, non-citizens who are sometimes eligible for certain kinds of rights at different kinds of levels of governance. The international human rights regime relies on international laws and transnational governance as a universal foundation and specifies governmental obligations towards all persons, regardless of their citizenship status. As commodities, services and social protections can be bought and made available to all who can afford to pay. As a set of community ties, social protections depend upon individuals' abilities to turn to family or friends and mobilize their social networks, as well as activate connections with civil society organizations to manage risk and to get ahead. But when the state steps back, we have a laissez-faire set of unregulated approaches to social protection that step in to fill the vacuum. Individuals are seen as better suited to make their own decisions about what kind of protections they want to buy from the market. And some logics take inequality as a fundamental problem, while others deem it normal and just something to get along with. But clearly, many people are left out and unprotected and more vulnerable when the state steps back from the social protection business. Okay, next slide. But the central question that remains is, how do individuals and families actually get access to social protection in the context of mobility? They do so by creating resource environments, and that's what these next 3 slides show examples of. The scope of the resource environment and its effectiveness depend upon the distinct logics of social protections that I just laid out. So people are accessing social protection from the state, from the market, from NGOs, such as labor unions or churches or other nonprofit immigrant rights organizations, and from support available through friends and family members. And the resource environment is what is actually available to an individual in their toolkit, as opposed to what's theoretically or legally available to them. The cluster of protections an individual or a family can assemble depends upon a lot of things: the nature of the market, the strength and the capacity of both the sending and receiving government, the third sector organizational ecology, so things like the number and types of organizations, what they do, and their capacity to provide, and the characteristics of individual migrants and families and communities, like where they come from, where they're living, their ethnicity, their race, their religion, their class, and education. And in some cases, all 4 potential sources of protection are available in both the country of origin and destination, and in others they're not. But resource environments also change dramatically over time. So they by leaving some groups protected and others increasingly vulnerable, different kinds of analyses and different kinds of alliances and struggles continuously transform what's on offer. So for example, think about the fight for universal health care in the United States, which gave rise to a lot of cross-cultural coalitions that produced, at least temporarily, more favorable conditions for all, including documented and undocumented migrants. So let's take a look at these 3 examples of resource environments. This is one of a college-educated, well-employed female citizen in Sweden. She doesn't have a transnational resource environment. She can get most of what she needs from the state because the state is such a generous provider. If she needed to, she could purchase protection from the market, but she doesn't need to do so. And she doesn't need to turn to third sector organizations, but she does have a lot of friends who have have a lot of social and human capital who could help her if she needs help. Okay, let's look at the next one. Erica, you want to? Yeah. Okay. So the next, this is a similar slide of a woman with a similar profile who's in the United States. So college educated, well-employed female citizen in the US. Here, the state and the market arrow, the size of the arrows is reversed because, as you know, as you all well know, those of us who are watching from the United States, we have to purchase most of the protections that we have, and the state is much more stingy. Here again, though, this woman doesn't need to look to third sector organizations, but she does have people with who would be able to help her if she needed help. And then let's look at the last one. So this is the resource environment for a woman living in rural Mexico who's working in LA. And this is a transnationally constituted resource environment. So on the US side, you see there's a dotted line from the state point of view. And that's because she's not eligible for anything from the federal government, but she is eligible for some very basic protections from the government of California. She can't afford to buy anything from the market. She does rely on her church and the food pantry on a pretty regular basis. And she also relies on individual ties to help her with questions about housing or childcare or where to get a new job. And on the Mexican side, when she goes back to Mexico, she can use she's eligible for the Mexican health insurance system and also for Social Security. She's purchased a home in her home village where her mother and children are living. So that's kind of her retirement social protection. And then there are NGOs working in those villages, in her village, that are helping with health and education. And she has a lot of people helping her and her mother to take care of her children and to take care of her business back home. Now, 3 things are important to notice about this example. The first is that rather than having all of her needs taken care of by one nationally bounded source, she has to piece together most of her social protection needs from a large number of disparate, informal, and transnational sources. Second, no one source covers all of her needs, as indicated by the relative thinness of some of the arrows. They're largely they're not transnational, they're not contractually guaranteed as well. So they're therefore unreliable and they disappear. So while laws contractually obligate states to provide for their citizens, and when we buy something in the market, we get most of what we've paid for, there's no such guarantees for people relying on social networks and third sector organizations. Again, it puts a lot of the onus back on the individual. Each can withdraw their support at any time and without recourse for migrants. The resource environment of this woman also really changes based on where she lives and what time we're talking about. So say she was a woman who came from Zacatecas, from an indigenous community to which she was a citizen and that was governed by usos y costumbres. She would be fulfilling some responsibilities in that community, but she would also be receiving some protections from that community. And say she lived in New York City or New York State. What the government of California and the city of Los Angeles offers to undocumented migrants differs from what's going on in New York City and New York State. Or say she moves to Wyoming. Well, that's a place that's not such a new destination anymore, but still doesn't have as well developed an infrastructure for immigrant rights and immigrant care organizations. And the strength of the labor market also varies, which affects how willing employers are to hire undocumented workers and to give them any sort of support. And finally, since there are fewer immigrants living in a place like Wyoming in periods of really heightened xenophobia, this woman might be very reluctant to seek care because of reprisals and being identified as an undocumented laborer. I'll turn it back to you, Erica.
Sorry, I'm having issues unmuting. Give me one second.
What'd you say?
Been having issues unmuting. Can you hear me?
Oh, yes, we can hear you.
Okay.
We can't see you though.
Okay, well, Probably more important to hear me than see me.
Yeah. There you go. Now we can see you too.
Great. So what I want to do just really quickly is kind of run through an example of kind of how people manage their transnational resource environments through one stage of the life cycle. So we go through 5, children and families, education. We have kind of working age people who have questions of labor or health. And then we have kind of aging and elder care. So we can kind of think about healthcare as being split into 6 key components. We have medical staff on the move. We have medical systems on the move. We have access via remittances. We have patients on the move. We have access for the undocumented and global governance. So just to give a few examples and kind of pull all this together, if we think about providers on the move, for example, we go back to my opening scenario of kind of walking out of a building and being hit by a car. If you ended up in the emergency room, there's a 1 in 7 chance in the US that the doctor that would treat you was born in India. 29% of the doctors in the US are foreign born, and 16% of nurses are. And we see similar numbers if we look at, say, the UK and Canada and Ireland. And just to go back to UK as an example, the National Health Service in the United Kingdom could not survive without non-national medical staff. And so this is great if you're a patient in one of these countries and you have access to a doctor. But it maybe is not great if you are living in India or the Philippines or Jamaica or any of these other countries that send out a lot of highly skilled healthcare workers, and you need access to care. So there's a kind of a question of how can countries benefit from the skills of their own citizens when they leave? So that's where we start to see one potential solution to this is actual medical care systems on the move. So Peggy mentioned kind of cross-border insurance in California and Mexico, but we actually have entire hospital systems are now transnational. So Johns Hopkins University not only has their main campus in Baltimore, but they have medical campuses in the UAE and Saudi Arabia. And this is not just great for them, but it's also a way for countries to help keep medical staff in the country or at least in the region, and then have advanced care options for local or regional residents. So in these cases, what we see is, again, going back to some of the earlier slides, these territorial shifts, right, in terms of the sites of care, in terms of the scope of state responsibility for citizens, and in terms of scale of access. If we think about individual access via remittances, and going back to the Johns Hopkins example, the hospital complex in the UAE may help keep highly educated workers at home or in the region, but it also pulls in a lot of less educated workers to actually build and maintain the hospitals. So India is a prime example of this. India exports doctors, and it also exports a lot of construction workers in the Gulf region in particular. And we know that these workers send remittances home, and we know those remittances are deeply impactful, especially for children, right? That children in households that receive remittances are measurably taller and heavier. They're more likely to be vaccinated. They're generally healthier. But this also creates tensions. Remittances may reduce child mortality, but medical brain drain reduces overall mortality, or increases, excuse me. And that spending more, we know that spending more on private healthcare weakens public healthcare systems. So the first point about medical tourism, and going back to the India example, high-tech medical chains like Apollo in India can both lure doctors back home or keep them there, but can also offer services to local residents through volume discounts and cash-paying foreign patients, thus expanding access to high-quality care, again, offering protection for some. But there's still kind of questions of precarity that these centers tend to generate a lot of internal brain drain. So doctors shift to urban private clinics, and the public sector in rural areas are underserviced. And this certain kinds of services raise moral questions. So surrogacy is a key example of this. Healthcare for the undocumented. We know that this is a perilous situation because healthcare is often restricted to citizens. Then the market is inaccessible. We find some slivers of hope when we start looking at different scales of governance, however. So some work that Peggy and I have done in the past is on seeing the emergence of gray zones where there's policy discrepancies between national governments and subnational governments. And these may create opportunities for non-citizens to get access to care. We've seen this happen in Spain. We see it in the United States, the US government policy versus, say, California state government policy. That said, this is perhaps one of the most politically fraught issues in most Western liberal democracies with high levels of migration, and Europe in particular. So on the one hand, giving immigrants access to the welfare state is a key driver of support for far-right populist parties. And yet immigrant workers in healthcare help to keep these national systems afloat. So there's a real question here, a question of concern as to whether or not fulfilling the promises of social democracy via kind of immigrant workers that pay into pension systems, that provide care in national health systems, present a threat to liberal democracy if it facilitates the rise of populist authoritarianism. And finally, if we think about global governance of healthcare in the context of transnational migration, clearly we're in a moment where we see an enormous amount of both formal crisis coordination through states due to massive refugee flows, and also non-governmental coordination through groups like, say, Doctors Without Borders. So just thinking about lessons from across the life cycle, traditional forms of social protection are kind of giving way to or operating in tandem with transnational forms of social protection. And we see this across kind of the territorial shifts in site, scope, and scale. We see kind of shift in sources of social protection. We see kind of the decoupling of kind of social and political citizenship. But again, we keep coming back to this issue of protection for some can mean greater precarity for others. So when we think about going from national systems to transnational systems of social protection, inequality may be shuffled, right, but not necessarily eliminated.
Okay, so I'm going to move towards the conclusion and say something about the implications of what we found and then some next steps. So the world we describe is not a world of welfare without borders. Indeed, many of the most generous, affordable arrangements covering migrants and citizens abroad still face major challenges over inclusion, coverage, and differences in cost, access, and eligibility. As individuals juggle and negotiate commitments and responsibilities, so too researchers need to consider the changing constellation of factors that influence people's choices about risk management. Rather than thinking separately about getting a better job, educating children, or caring for aging parents, people take all of these challenges simultaneously into account and come up with a comprehensive strategy for moving forward. Our vision of protection, and in particular, the way it's accessed transnationally, goes far beyond mere survival. Transnational social protection not only provides a way to manage risk, but it's also in a lot of cases an intergenerational mobility strategy, a tool for actualizing an individual or household's life projects. Migrant workers from less developed countries send remittances to protect family members from social and financial vulnerability. But in places like Hong Kong, Taiwan, and mainland China, middle-class parents send their children to be educated abroad to protect the next generation from future risks, such as political insecurity and a changing global economy. Writing this book has been a sobering experience. The messy tensions produced by the precarity and freedom to which transnational social protection gives rise reveal several uncomfortable truths. At best, we believe rethinking the relationship between citizens and states, a process for which we advocate, will promote new policies and inform new institutions. These, we hope, will enhance and expand the range of meaningful, accessible choices available to individuals, allow them to break free from corrupt, inefficient systems, and extend social protection to previously excluded groups. But as Erica said, and I said, transnational social protection offers no comprehensive cure. What we're seeing over and over again is that inequality is reshuffled rather than remediated, and that enhanced protections for some lead to greater vulnerability for others. We're particularly concerned that migrants' voice be heard and their demands for rights be respected as social welfare systems in countries of origin and destination rely on them more and more. This interdependence seriously affects the politics of migration. Governments in countries of destination can't afford to shut out the nannies or nurses who care for their young or elderly, even when populism is on the rise. Governments in countries of origin no longer think of immigration as a safety valve because today's migrants exit and maintain their voices. Given the economic importance of remittances and the rising importance of the expatriate vote, governments of countries of origin are recognizing that immigrant citizens won't be satisfied any longer with platitudes. They demand that their voices be heard. We're also concerned that states are less and less accountable for the welfare of their citizens. Whereas professional, well-educated migrants have a lot of places to turn for social protection, the state remains the provider of last resort for many of the world's poor. What then is an appropriate role for countries of origin in providing for their immigrants? Which institutions, located where, should be responsible for protecting and providing for the many long-term residents without membership? These individuals, so integral to the care of the young and elderly and the construction, gardening, and restaurant sectors, for example, often live without access to basic services in the countries where they settle. Governments have to answer to the native born who fear that immigrants will unravel the social fabric, but aren't they also morally responsible to care for the people that keep their societies running? Another uncomfortable truth involves tough questions about distributive justice. What constitutes a fair transnational allocation of resources, especially as the consequences of transnational social protection in one part of the world often have so many repercussions in others? The decision to seek social protection transnationally affects not only migrants and their families, but non-migrants who stay behind. And Erica just gave some great examples of that. Doctors from less well-developed societies like India or the Philippines may be the backbone of healthcare systems in the United States or in Europe, but their departure leaves their home country's healthcare systems very weakened. International clinics that are designed to attract medical tourists may benefit cash-strapped migrants wishing to bypass long waiting lines or expensive co-payments for elective procedures in their homelands, but these individuals also worsen local disparities in access to care, even though a lot of times they promise to have trickle-down effects for local medical care provision. Remittances can enable family members back home to purchase goods and services, but the rising cost of living deeply hurts families who don't receive that kind of financial support. Senior citizens who move abroad for care fare well, but they displace locals who can't afford the facilities open to serve this new, more moneyed population. Our work then isn't just about migrants and their families, it's a response to widespread social injustice and inequality in today's global world. Our task in our book was to begin to tease out who's emancipated and empowered by transnational social protection and who's disempowered and even victimized, which configurations of actors and institutions enable more migrants and their families to move from surviving to thriving. We hope that our ideas provide some tools for policymakers, researchers, and concerned citizens who are committed to making sure that people everywhere get the basic rights and protections to which every dignified human being is entitled. So some of the next steps we are hoping to fulfill ourselves and organize in collaboration with partners around the world is to do much more research in particular regions and to try to tease out what the political economic factors are that make this work, these kinds of things not only possible, but durable. So they withstand the changing winds of policy, of political change. We also are trying hard to communicate in ways that policymakers and decision makers will find engaging and understandable and kind of applicable to their nationally bounded policymaking strategies. So just as we've all read and written a lot about methodological nationalism in migration studies, there's methodological nationalism in policymaking, and that's a big thing that we hit as a barrier in terms of having conversations about this moving forward. But we did find some really interesting examples of positive movement forward in regions. So, for example, in the ASEAN region, leaders there understood that to to foment more regional economic unity, they had to also foment more regional, cultural, and social unity. And so they put in place a universal health care insurance scheme and encouraged sending country governments to extend the coverage to migrants in the diaspora. In Latin America, the Union of South American Nations also was engaged in an effort at greater regionalization, focusing on health and areas how neighboring countries or regions within regions could collaborate with one another to provide access to migrants, but also to make sure that their credentials were automatically respected when you move from Uruguay, for example, to Argentina. And this was going very, very well, according to researchers Maria Belén Herrero and Diana Tussi, who said it was a pioneering first step. It's an institutional pillar to tackle issues of management and redistribution of resources in the form of human capacity for better governing health as a regional goal, as well as professionally for enhancing research and development. So here, this wasn't just about healthcare provision, it was also about coordinating research and the production of pharmaceuticals so that the countries in the global south could fight back against big pharmaceutical companies in the global north. But here again, these kind of collaborations unraveled when they took shape when there were leftist governments in office in Latin America. And as most of you know, there are more right-leaning governments in power now. And so these issues fell apart, these efforts fell apart. And so again, the big question that we're left with is what kind of arrangements are less vulnerable to changes in the political winds. So thank you very much.
Okay, terrific. Thank you so much for that excellent presentation. All right, Jean-Michel, do you want to let us know what you think about the book?
Hi, thank you, Roger. Good afternoon, everyone, and thanks to the CCIS and the CSIM for the opportunity to come and discuss this great piece of scholarship. In particular, I'd like to thank, of course, Roger Waldinger for the invitation, but also Warren Tam for the smooth communication and really the efficient organization. I was very pleased to receive the invitation to read this book for a number of reasons, but for 2 or 3 in particular, actually. First, because as a migration scholar, of course, I've been following Peggy Levitt's work for a number of years, and I do not cease to be amazed by her capacity to identify emerging global trends and set the agenda in our field of studies. Second, mostly because this is a book whose publication I had anticipated for a long time, as I'm myself active on questions of migration and social protection. And third, because in early discussion with Peggy about this book, I understood that this was a collective effort with Erica Dobbs, Kenshin Janssen, Ruxandra Paul, and they had each of them had developed their separate research agenda and their own fieldwork. And I was really curious actually to see how a monograph with a strong theoretical proposal could emerge from this research process. So to begin my talk, I should stress that this book is a true feat of strength, or as we would say in Francophone countries, a tour de force, right? So the authors did manage to write a coherent and comprehensive manuscript. It's richly documented from an empirical standpoint, and it's backed up by a clear theoretical proposal, a short summary of which you heard today. In the coming minutes, I want to highlight briefly what the main strengths of these books are, in my view, and then move on to 3 crucial questions that remain unanswered by the migration scholarship when it comes to migration and social protection, and highlight how this book puts us on a path to answering them in the future. And I think that connects quite well with some of the points that were made in the conclusion. So to begin with, I think the main strength of this book, in my view, is that it addresses 3 shortcomings of the migration and social protection literature. One of the central issue in this body of literature is siloization, meaning that social policy scholars, political scientists and legal scholars working on the welfare states, economists and migration scholars, they've developed their own separate discussion on those issues over the years, and they don't talk to each other, basically. And this book really challenges this way of working. The literature covered in the book is quite impressive, and it's articulated in a way that addresses many of the shortcomings of the siloization of this question. Secondly, the book has a global ambition, which in the area of welfare is a tremendous challenge, of course, given the many idiosyncrasies of the welfare systems and the variations, and also the variations in the level of well-being observed across the world. Yet the book articulates the supranational, the regional, national, maybe to a lesser extent the subnational level, together, and they do that with the proposed concept of hybrid transnational social protection. Third, the book avoids, in my view, one of the major risks I perceived in the development of migration studies, which is hyper-specialization on topics, which prevents us from seeing the big picture often. The book, I think, quite skillfully does that by connecting, for example, the literature on brain drain with the literature on patient mobility. I think Erika today actually made that quite clear, illustrating how you were trying to look at different bodies of literature and trying to see in a similar social protection area how mobility of workers, but also mobility of patients together with the needs of the immobile people all connect together and make sense to be perceived in a single analytical framework that you've designed. So you do that with health, you do that with lifestyle migration and global care change. You do that also in the books with connecting the literature on migration and education with the literature on diaspora policies in the field of education. So moving on, as I said, I wanted to highlight three critical questions, which I think really remain largely unanswered in the social protection and migration literature. And the first one is, what role is there for the state in responding to social protection needs of immigrants? The book starts by contextualizing the shrinkage of the welfare state in different parts of the world. You highlight also the pressure of the market to take over some of the mission, the traditional mission of the welfare states. You highlight the politicization of welfare that leads to restricting immigrants' rights, etc., etc. So you make this point quite strongly at the beginning of the book about the shrinkage and the welfare state being under attack. However, throughout the book, actually, we also see that, and maybe you don't acknowledge it that clearly, that the state actually keeps quite a strong ability to protect. I think the chapter on labor is the best example, where you show clearly that it's really at the public level, at the nation state level, that there is really a capacity to legislate, but also enforce, most importantly, labor laws, and that it's still relevant today. So I think that was an interesting element, that to start with this very strong statement on the shrinkage of the welfare, and yet throughout your data we see many examples of the state resisting quite well. Similarly, the book shows in numerous places how states, particularly the standing state, is innovating in the area of welfare. The case of Mexico is probably the most famous one. Alejandra Delano had already hinted at it before, but I think you pushed this a little further. And of course, many of us know the initiative of Seguro Popular and how it was expanded partly to citizens residing abroad. So we are left as a reader with an ambivalent impression about how you really perceive the role of the state. Especially so since, and this is of course an issue of timing, that you mentioned in the conclusion that the case of the COVID-19 crisis, and you hint correctly in my view that this was an occasion for the state to really reaffirm its predominance in the area of social protection. And I think one has to agree with that, because when we observe the speed at which many governments have spent significant shares of their GDP to deal with the health emergency, and of course also its socioeconomic consequences, one can only conclude that there is still some, or strong, and depending on the case, it's public capacity to lead in the field of social protection. But what I think the case of the COVID-19 crisis showed even more clearly is what triggers really investment in social protection. in this case is the framing of crisis. And there's been a lot of work in recent years in political science, sociology, and especially in the field of migration about the use of the concept of crisis. But in the case of the COVID-19 crisis, of course, a virus that was threatening lives and threatening the economy, this concept of crisis, to justify the enormous spendings in the area of social protection. So in the study of migration, the concept of crisis also generates similar downpour of money, but never for protection. Rather, it's always for the securitization of border that the money flows. And that's where the state mobilizes its full apparatus. And the work of some colleagues in California, for David Fitzgerald, not to name him, on securitization of asylum policies clearly shows that also. So accordingly, if the state capacity to act in the field of social protection is still present, then the challenge that remains unanswered is how can we facilitate the shift of resources from the securitization of migration to the protection of immigrants, or rather, how can the framing of immigration as a permanent crisis be used for protection rather than for securitization purposes? I'm not necessarily expecting an answer to that because it's an enormous puzzle, but this is just the very stimulating points that the book is triggering. The second question that this book opens for the future research, I think, is how intertwined are mobile and immobile individuals' needs for social protection. So across different chapters, we see that the international mobility of some is essential for many others to be able to remain immobile. This is true for the Italian pensioners who depend on the Filipina or Ukrainian care worker to stay home. As we also know since the early work of Arlios Child on global care chain, international mobility of workers is also indispensable for some categories of native workers to pursue careers on their local labor market, simply by the fact that it allows externalizing of care responsibilities to immigrants. So we also know for a long time that employers are capable to put pressure on policymakers to adopt more liberal policies in the area of migration and facilitate the mobility of immigrant workers, and in some cases also facilitate their access to social protection. But what we don't see, and you clearly highlighted in the talk as well, is the other how the other major beneficiary of labor migration is not mobilizing in the support of immigrants' rights. And this other beneficiary is, of course, the upper middle class. In the case of Europe, the European upper middle class, and probably I think the rationale extends also to North America or Singapore, the upper middle class relies on migration for the maintenance of its lifestyle. And yet, in Europe at least, it's also the category of the electorate that seems increasingly seduced by nativist and anti-immigration discourses and support political parties that defend such position. So the challenge here is therefore also for policy making in the area of social protection to acknowledge that the well-being of non-movers is dependent in parts on immigration, and that accordingly, effective social protection policies cannot be thought independently of protective immigration policies. My third point, and that's the last one, it's the third unresolved puzzle to which this book contributes, is how can we address inequalities in access to social protection? And that's what Peggy devoted already quite a bit of attention in her conclusion. With a growing interest for question of inequality that was triggered by influential work such as the one of Piketty over a decade ago, we know that inequality is a major threat to democracies across the globe. Following the suggestion of Thomas Weiss, and therefore one should look also at how inequalities reproduce in the transnational social field. And this book does exactly that. On numerous occasions, you show how disparities in access to social protection are working and how it affects the sending and receiving society. You do that particularly with the question of remittances, and it's quite telling, I think. You show how remittances can create inequalities in access to healthcare among members of the same local community, and that depends whether they have a family member abroad or not. in my own work, I've also argued, and I've seen that with Congolese families, that remittances can disincentivize the beneficiaries from supporting the development of public health systems, as they prefer to go to private practitioners that are perceived as more available or more competent. So the challenge that remains unresolved here is to determine how can the hybrid transnational social protection strategies of immigrant families not lead to a disinvestment of the state, nor to the creation of new inequalities, but rather support social protection in their historical function, which is to ensure a modicum of support for the less privileged, no matter where they are, or in other words, to really tackle inequalities. So with these final thoughts, I wish to really congratulate Erica and Peggy as well, as your other colleagues, of course, who are not here today. And I really want to really encourage everyone here to read the book, because the few minutes I've taken here are not sufficient to really stress how important of a contribution it is. But also I want to stress that I hope to see more of this kind of collaboration in the future, as it clearly demonstrated that it's an adequate way of working, of producing really richly documented monograph with a truly global ambition. And thanks for the time again.
Okay, thanks, Jean-Michel, for a terrific comment. Or so, Peggy and Erica, do you want to respond briefly, and then we can turn the discussion over to the audience?
Sure. Jean-Michel, thank you very much for your very kind words, and we appreciate them very much. And of course, we've been admired and influenced by your research as well. So we've been having this conversation together, and it's a collective effort. So I think that we, states are still protecting, and they need to be protecting. And so it's not like a shift from nothing, from everything to nothing. So I think part of the question is about unpacking the state to see how different parts of the state contribute to this puzzle, all of the questions that you're asking, really. And not just the sending state, the receiving state, but the sending state. And I kept thinking when you were talking that is this a question about framing policy? Like, we need to look at the literature on policy making and how you frame a problem and then what the solution is. So if you frame it as, and I've been inspired lately by critical race theorists talking about interest convergence, because usually nothing happens unless the middle class, upper middle class people that you're talking about who depend upon the nannies or the senior care workers, nothing happens until their interests are under siege. And so you almost have to think about either the way you could frame the policy problem in a way that shows both groups that their interests are converging to protect more people in a more equal way, right? And yeah, and so I think your questions are spot on, and what I think we need to do is to convene regional conversations about this, which we've started to do in Latin America and in Taiwan, and with Ken, because Ken is from Taiwan. And I just hope that we can figure out a way to have more discussions about it, and to look at not just the national state, but I'm very convinced that the regional governance structure is an understudied piece of this, even though these regional governance organizations vary a lot with respect to their strength and level of resources. I think that's a place to really look. So thank you for your great questions.
Okay, Erica, you want to say a few words?
Yeah, just two things really quickly. Again, thank you for your feedback. I had kind of two thoughts. One is this kind of question about beneficiaries versus advocates. And that was something that I think in kind of the conclusion of the book, we were, I'll just admit, I in particular was really cranky about, right? That there's a real disconnect when you have politicians who run on, we're going to protect, our social welfare programs, and we're welfare chauvinists. We care about welfare for our citizens, but then are also run on these like anti-immigration platforms, right? You can't have one without the other, and we see that. So kind of part of our plea in the book is basically like, let's be realistic, right, about what's happening here. That undocumented women facilitate, professional women in New York City and LA and London and Madrid, right, working outside the home. Et cetera, et cetera. So yeah, I mean, as you were spoken, it was like, yes, please get real, right, in the notes, because I don't think that people are being realistic about this. But the other thing that I think is happening here with the state, particularly in the context of the US, is kind of a phenomenon that I think gets picked up on in a lot of the literature on social policy, in that the submerged state, that the state is there and it's huge, but we don't see it, right? Because everything has been outsourced, right, or subcontracted out. So if we look at actual kind of government spending on different forms of social policy, it's significant in the United States. Like, we spend a lot of money on this stuff, but we don't see that it's the state doing these things, right? So I think both of these problems in part are problems about perception. And I'm not entirely sure how to change that, whether, because kind of saying like, politicians, be realistic. Like, I'm a political scientist and that's not going to happen. So like, if it's not politically advantageous, but just to say that there's clearly like, there's perception issues, right, that are in play, both for the state and in terms of policies that benefit maybe me as an individual in my everyday life, that I don't actually support in my voting behavior.
Okay, excellent. So why don't we now turn to the discussion? If you, some of you, I can see you've opened your video, so you could raise your hand. Others just use the raise hand function. I'll be happy to call on you, or you can send me a question that I can in turn read. Okay, Nihal, please go ahead.
All right, thanks so much for this presentation. I have a question that is partially a clarification question and partially a conceptual question on the idea of the resource environment. So what I understood was that this is kind of like one individual's various options of kind of social protections they can draw on. And I was kind of curious about the division that you guys made between like the citizen versus the immigrant, because I'm thinking about how, a citizen in the US, for example, is not a migrant, but they're quite mobile and they might be able to move across borders to, get some sort of welfare resource, whether it's, someone who's in San Diego who can go to Tijuana and get medicine for much cheaper. And so their resource environment would also be potentially transnational, right? So there's this kind of like, just like the world of options that someone has and whether they choose to avail themselves of those options or not. So like, related to just that thought, I guess I'm curious about the distinction between migrant, non-migrant, or whether it should be something like a spectrum of mobility, or and also where like tourism fits into that, because like maybe a hypermobile person can like go get their thing and come back, but is that transnational in a different way from like a migrant who migrates somewhere for those types of things? Yeah, thank you.
Okay, excellent. All right, Peggy, Erica.
Should we take a few questions maybe?
All right, let's take another one. Ruven.
Thank you, Roger. Thank you, Peggy, and thank you, Erica, for this excellent presentation, and to Jean-Michel for the commentary. Thank you, Peggy, for sending me the book a few months ago. I actually have not read the entire book, but I actually did read the introduction, and I found it extremely interesting. I'm giving it to my students on a seminar on migration industry and migration infrastructures. So we'll have a chance to have a deeper discussion on this. Again, I read the introduction a few weeks ago, and from my recollection of kind of like my questions and my reaction to the intro, it made me think right away about the sort of post-national citizenship literature that was in vogue in the migration literature 20 years ago or so. That literature, in some ways, I mean, it was very sort of powerful, very popular at some point. It was also sort of short-lived in a way, because you know, the research community and the world actually saw how the state came back with a lot of sort of restriction, punishment, criminalization of immigrants. So I have a basic question about how much do you the research group, the research team has built on that literature on post-national citizenship in order to develop your framework. Maybe yes, maybe not. Maybe using that and marrying that with social network literature that also has been very salient in migration scholarship. And then the second sort of common question that I had, and again, this is kind of my recollection on my immediate reactions reading the introduction to the book, has to do with, this is something that you already noted in your presentation, of how precarious some of these arrangements are, right? Some of these transnational social protection is really built on the back of migrants, immigrants, right? In part because this is an area where a lot of people get to have their cake and eat it at the same time. In other words, you can have, as you have just mentioned, a lot of folks around the world who are part of this upper middle class, right? Who can, right, vote for right-wing populists, say, restricting, who have an agenda restricting immigration, and still have their domestic servants, doing the work, right? So, and there are also a lot of, sort of trends that I think nationalize essentially sort of resources, right? And reestablish forms of closure that make it difficult for any kind of institutionalized transnational arrangement to last, even when you might have sort of, good intentions on the part of some policymakers and scholars and intellectuals and so on. Anyway, I could say more, but I'm going to stop right now. And thank you again for your contribution.
Okay, why don't we take a response to these two questions, and then we can see who else would like to engage.
Erica, do you want to start, or do you want me to start?
I can take maybe one piece of this.
Go ahead.
I mean, I think maybe kind of stitching together a response to both of the questions. And that is, so we had this kind of question of mobility, and then this question of, does the state still matter? And I think the answer to kind of both of those is maybe, well, the state matters because citizenship matters, because it's citizenship that determines mobility, right? Having an American passport means you can pop in and out of a lot of places quickly and go back, right? You don't have to permanently move. You can kind of go get what you need and come back, and you don't even need a visa to do that, right? And that is not a reciprocal relationship often with the places that people are going to pop back from. So yeah, I think it matters, and I think it matters internally as well. That the U.S. based literature, and here I'm thinking of kind of Jamila Mishner's work on Medicaid in the U.S. is that even internally, right, mobility matters for what you get. That the kind of social benefits you get living in California are not what you're going to get in Alabama, right, or Michigan, or like disability insurance, for example. It's going to vary enormously state by state. And so she's kind of made the argument increasingly that federalism creates differentiated citizenship, right? We all have the same passport. We all have the same right to leave, but we don't have the same rights internally. So yeah, I mean, I think maybe I think the state definitely still matters, precisely because of it makes these decisions about citizenship and who can move and can't move. But I think the other part of the story too is that class really matters, right? Because not everyone can afford to pop down to Costa Rica for dental care, right? Like, so, and class matters, right? Who gets a visa? Who gets to go to New York if they want to go, right? Versus who doesn't and gets denied a visa to the US. So I think all of these things still matter, right? But maybe they matter in different ways and at different times and in different places.
Which is kind of a good segue for my response, which is, you know, your questions are great, and they ask sort of, they're methodological in the sense that how can you generalize about something that's so complicated? And so Nihal, your question is, did I get that right? Your question is about, you know, the continuum of mobility, and you know, so and the continuum of mobility based on legal status, right? And so how could you draw those graphs that I show, those diagrams that my husband so great, you know, diligently puts together every time I need something like that, to capture these different forms of movement? Because yeah, absolutely, you know, it's different to, you know, pop down somewhere and get cheap medicine or go get elective surgery and all of those things that very different than what Ruben is saying about all the very poor people who are totally blocked. And the other thing, that the methodological thing that I'm left with is also sort of how do you think about different kinds of states, not just levels of state activity, but different kinds of states that, you know, how in the migration and development literature, there's the developmental state or the this kind of state, you know, almost like, how do you unpack those characteristics, those things that states are still doing, and then trace the implications of that for inequality and social protection?
Sorry, I had muted myself. Other questions? Okay, Elif?
Yeah, thank you. Thank you so much for this great talk. And I really look forward to reading the book. And I'm sure you talk about this in the book, but I was wondering if you could talk a little bit more about, like, you know, if to get protection, you may want to, like, you know, I'm interested in the responsibility or like obligation side at different levels, not only like paying taxes to the states, like as a migrant myself, yeah, I do pay taxes, but I don't get, like, you know, voting rights. But also, like, you talked about, like, the third level, I believe, actor, like, you know, the church, or, you know, do you visit your church more often to get different kinds of protections, or how often you visit your family back home, like that kind of obligations? I was just curious about the other side of, you know, to get protection, like the mutual interactions that people may have to receive certain protections. And I might be totally off, but yeah, I was curious about that. Thank you.
You're asking, what do people have to do to get the protection from the church? Or I'm not sure I understood the question. So maybe just try again.
Yeah, not really, not necessarily an obligation, but I guess they have to. I was just curious about just at the different levels of receiving protections that you outlined. I was just curious if people had to, yeah, I guess you are right, you know, requirements, but
and when I was different levels, are you saying the market and the state and the NGOs,
yeah,
family?
Yeah, different levels. So I was with that, that came to my mind, and you may not have an answer to that, but
no, it's a great question. I think Erica can answer about the state and the market, and I can answer about the the NGOs and social networks. I mean, because I'm sure there are a lot of people who are here in this audience that are well versed in the kind of negotiation of reciprocity between, you know, the migrant member of the family and the non-migrant members of the family, and how, you know, what social protections are basic social protections, and who's responsible for what, and what kind of sacrifice, and that's an ongoing really difficult thing. And your question made me think also about like evangelical churches as a place for gaining social protection. So when I wrote God Needs No Passport, there were in the Latino community, there were, Catholic churches that were really upset about the infringement of evangelical churches, and why were they gaining so much ground in these immigrant communities? Well, because they offered all kinds of help and solidarity and, community that the Catholic Church wasn't doing. And so, but they also expected you to show up to be able to get what you were going to get. So it is this kind of dance with reciprocity, and what does that mean? So I don't know if Erica wants to add something to that.
So this is really interesting. I was trying to kind of map it all as you all were talking and thinking about the state. So if I understand maybe my interpretation of the question is, we've been talking a lot about rights, but not necessarily about responsibilities, right? And so when we think about citizenship, we talk about this a lot, right? That we have rights as citizens, but we have responsibilities to the state that we're a citizen of. Maybe we have service obligations, maybe we have a draft, right? Maybe we pay taxes, et cetera, but there's some kind of reciprocity involved. And so I think that part of what we look at here is, and especially thinking about the state and citizenship, I think part of what we're seeing is that there's almost a decoupling of this, and that everybody is rethinking this right now. So just to give, and some ways of thinking about it are problematic, let me just say. So let me just give you the example that I always have a hard time with. If we say that someone migrates to another country and they are contributing economically, and because they contribute economically, they should have certain rights while they're there, that the state has a responsibility to taxpayers. And this is kind of the logic of having like location-based rights. But then the problem is, what happens if you can't contribute economically, right? Are you now not entitled to rights or protections, right? Children don't contribute economically, and the elderly often can't. So I worry a little bit, right, about like some of the implications for this. And I don't really have a real answer for it, other than to say that that a traditional logic of obligation to people in your territory because they are citizens bypasses all the kind of like the material contributions component of this. If we start to say that we have obligations to people within our territories because they contribute, this opens up a different set of questions for citizens as well. Maybe we just say that, if we go back to kind of even like kind of definitions of state, that a state has a responsibility to anyone and everyone within its territory by virtue of being a state, then that's also a really different conversation then, right? So I think this is actually a really important question, and that's what states are grappling with right now, especially liberal democracies, where we have always said it doesn't matter if you're a citizen, everyone here still has certain civil rights because we're a democratic society. And so the question is then, do you also have certain kind of social rights? And that's a little bit murkier. So a lot of this question is kind of what we're trying to parse out, really. So.
Okay,
let me take one question in the chats. So from Mariam Abdallah, would you say there is a trend towards the idea of social protections as commodities in legislation or some other domain? I mean, you mentioned the idea of social protection as commodity, I believe. So perhaps you could say a few words, and this would be then the last exchange with the audience.
I think that would really depend upon where we're talking about. So, I mean, in this country, yes, it's always been a commodity. Many of us get our social protections at our workplace, and we're paying for it. And so, if you come from a more, say, from the Scandinavian context, I think those states are pulling back, and so people probably have to purchase more protections in the market, but I have no idea whether the legislation would reflect that kind of philosophy. So I think it's a very, it's a great question that's very context specific. Erica?
I think, yeah, I think, so this feels very American, right? That I think to take it back to kind of the theoretical framing, we talked about these different logics, right? And clearly here we're using a logic of the market. And often we hear justification for social protection because it serves the market, right? That healthy workers are good workers, so we should be sure that they're healthy. I guess what we try to close with the book is that maybe that having a conversation about kind of a logic of human dignity is something that's really missing from this, but is important, right? So, I mean, realistically, things in this country tend to happen because they're seen as economically advantageous and there's some kind of material benefits to someone. Like that is the logic of American politics and social policy. Maybe I'm being optimistic or Pollyanna-ish in wishing that we could move past that and have kind of a different underlying logic for social policy. And that's literally kind of the closing paragraph of the book. And I should note that I am not by nature an optimistic person.
Okay, but maybe.
Hmm?
Okay, I was just going to, on that note, I was going to say maybe a note of optimism is the ideal way to bring this session to a close. So I want to thank Peggy and Erica for a great presentation. Thank you so much, Jean-Michel, for joining us at an unreasonable hour in your time zone. We really appreciate it. Thanks everybody for joining us. This is the last remote event of the academic year. So thanks to all those of you who've been with us throughout the 2023 academic year. And I hope that you will join us again next September. And wishing you all, of course, a great summer and a great end to the academic year. So
Thank you very much.
everyone, looking forward to seeing you.
Thank you very much.
Thank you. Bye-bye.
Bye-bye.
Bye.